NTV.
Welcome back and thank you for staying with us right here in Morning at NTV. My name is Rami Busiku. Well, Extraordinary Media Group, which is led by Mr. Bill right there, and the Ministry of Health have initiated a joint public-private partnership awards project to recognize players creating significant societal impact. Yes, that's the key phrase. Significant societal impact across the vast spectrum of Uganda's health care system. This initiative will serve as a unique opportunity to reward and celebrate the exceptional contribution of those health workers and other key health sector stakeholders. The annual awards project will feature remarkable frontline healthcare practitioners such as the doctors, the nurses. You also have the midwives, radiologists, community health workers, and other players. To tell us more, we have the senior public relations officer at the Ministry of Health, that is Emmanuel Arinebiona, and also Mr. Bills Agaba, the coordinator of the Heroes in Health Awards that shall be launched April 3rd. So they join me right about now. Very good morning, gentlemen.
Good
how,
morning.
how are we greeting now?
Good morning.
The fist bump works? It's the fist greeting.
Just
Yeah.
greeting,
I
or
saw
you
a
use,
I
you
follow
use
it,
your
I was going to talk
foot,
about that. I
or
saw a
you
photo
bow,
yesterday.
you bow like the president
bow.
did, yeah.
All the leg shake.
Oh, yeah, the leg shake, or you bow like the president did with the guest he had.
Indeed. So,
Yes.
Mr. Bill, let me start with you. This idea, Heroes in Health Awards, how was the idea mooted, rolled out, or why?
Yeah, thank you very much. Heroes in Health Awards is a private sector initiative to support the health sector in terms of visibility and also branding, but also to increase our quality of care that we get from both public and private sector facilities. So it is a working project between the Ministry of Health and the private sector, us at Extraordinary Media Group. Yeah, so we are the implementing partners for this idea that looks at our health workers, as I have said, both in private and public facilities. Yes.
I'll get back to you on the issue of nominations. Mr. Enebiona, what is the significance of these health, these awards to the health ministry?
Thank you very much. One of the major objectives of these awards is to ensure that we motivate our health workers. We've had issues to do with remuneration, non-monetary interventions to ensure that our health workers serve better. So one of the objectives is to motivate the health worker or anyone who is making a contribution to health service delivery in the country. Another objective is to foster innovations. People who have come up with interventions like pneumonia testing applications, we have to recognize that effort because at the end of the day, it is aimed at making health services better. Then also we want to encourage private partnerships to create a win-win situation. So another objective is to see that we have a number of private sector players join in to support the healthcare system. And one way of doing it is to come in together, and we have the Heroes in Health Awards.
Heroes in Health Awards. Before we talk about the nominations for those awards, let's talk about the healthcare system as it is. Do you think government has done enough to actually fund the healthcare system in Uganda, given the fact that, well, according to some people, government has done something or more than enough, but then still there's that poor quality services coming out of those private and public health facilities? What do you think is the problem?
So it is a work in progress. I can say we are not there yet, but we are making progress, which I can say we have made some steady progress in that line. But also why we are really appreciating health workers, it's one way of changing attitude. We hope to reach out to them and change their attitude, because if, for instance, someone is at the ward, we want to ensure that the patients do not have wrong waiting hours before they can see a doctor. Or even when a midwife is attending to, for instance, a delivering mother, the kind of communication, that is what we are aiming to change. Otherwise, in terms of funding, in terms of investment into the healthcare system, a lot has been done. So where I see things, we are really making serious progress and strides.
Even though we are only remitting 7% of our health budget instead of the 15 that is required from the Abuja Declaration?
Yeah, as I earlier told you in our off-air conversation,
It's a moving progress.
there are very many competing priorities. There are prerequisites like energy, because you need to have the infrastructure, the roads, the power dams, which are somehow now taking a big chunk of the budget, the infrastructure, the roads. But all these are prerequisites that ensure that we have better health care, because if we are talking about delays in delivery, a mother will delay because of a bad road to get to a health facility. So if this bad road is fixed, then it makes it easy for a mother who is going to deliver to access a health facility without hardships.
Indeed. Mr. Bill, let's talk about the heroes in health. One of them is Dr. Olive Kobusinja. I don't know if you took the time to read her book. It was launched on Friday last week, The Patient. And she made so many allegations within that book that were debunked by the Minister of Health, who actually said not everything in that book is actually right. But then I read the book and some of the issues that were highlighted in that book. Do you think she's one of those contenders that could be up for nomination when it comes to the Heroes in Health Awards?
Thank you very much. So how the award works is it's a public open award where nominations would not be controlled by those who are organizing the award.
So it's a public
So
award.
it's open to you, members of the public, to tell us who you think is inspiring you or who is giving you service at your health center. So I won't really go into discussing authors in the health sector, but that forms the crux of the matter in that it forms part of the conversation about the health sector, which is which triggers or helps us to have the health sector discussed in the mainstream conversations, like in the media, like we are doing now, so that then the budget, as you were saying, starts to move towards the Abuja Declaration. So yes, people like the authors who are saying something about the health sector.
So it doesn't matter if they're practicing actively or they are retired, because she's a retired doctor. So let's talk about the nominations. When do they start and when do they close? And who can nominate?
Nominations started on the 15th of March. 15th of April, sorry. 15th of February. Yes, it is a 1-month nomination process.
Yes. So
they close on the 15th of March.
Indeed.
We encourage members of the public. Already the nominations are coming through. You can go to our website, www.hiha.extraordinarymedia.com. There are 25 categories there, so it's a broad spectrum from people who are in the media to people who are manufacturing the drugs, who are delivering the drugs, or at your nearest pharmacy, up to the hospital level, where we have 2 categories of the awards. Some awards are meant for institutions that are doing great work, and other awards are meant for individuals. So all those details are on that website.
I would like to shed more light on the award categories. We also have the best health journalist, print and broadcast, because the Fourth Estate plays a key role in publicizing and ensuring that we have better health care in form of investigative journalism, solution journalism. So there is also the category for the media, and I really think it's been long overdue, because as someone who practiced as a health journalist, I think also we have to appreciate the mark made by the Fourth Estate. And also we have also those...
But before we get into the Fourth Estate, how much does the private sector contribute to the healthcare system in Uganda?
When you look at the budget, over 60% of the healthcare providers are largely the private sector. So that is a big contribution. And if you look at the funding that comes through partnerships, the Global Fund, the Gavi, all that is private sector-led investments. So that's why we really are fostering these collaborations to ensure that we move as a team in providing healthcare services.
Mr. Bill, what are the awards and how? Tell us about the judging process.
Yes, the awards are happening on the 3rd of April this year. It's when we shall have the dinner gala to announce the winners. The judging process for the inaugural is members of the public nominate their preferred candidates, and we have a panel of 7 judges who are eminent, majority retired medical practitioners. We also have reputable people from the media and also ICT because of the innovations categories that we have in the awards. And all this will be shared with members of the public in terms of how many nominations came in for a particular person.
Amazing. I'm afraid we've run out. I'm afraid we've run out of time, but thank you very much, Bill and Ainebiona, for having made the time to speak to us. The Heroes in Health Awards, 3rd of April?
Yes.
Yes, 3rd of April.
Nominations close on the 15th of March.
Yes, nominations close on the 15th of March. Thank you very much for having made the time to speak. Oh, there you go. There you go.
Yeah, thank you very much.
All right, and finally, I'd like you can just sit it right there. I'm going to end with your birthdays right here, 203. I have Henry Oscar Ogumbo saying happy birthday to my best friend, best geography teacher. Wow, I have ever met during my secondary course at Lumino High School, my dearest Master Mwandabi Augustine, age gracefully, my superhero. Thank you very much for that kind message. I also have M. Dew House, you saying, Zabo Peter, I'm following from Arua. Mukisa, happy birthday to my friend Sophia Tebi. And those are some of the people who are celebrating their birthdays on this particular day. And we do wish everyone who is celebrating their birthday in this month of March a good one. Well, right about now, the show has come to an end. My name is Romeo Busiku. Let's interface tomorrow. Have a good day. And this is Morning at NTV.